Amid the health concerns about COVID-19, another population is fighting a battle against a deadly disease, cancer.
The American Cancer Society says cancer patients are among those at the highest risk for serious illness from COVID-19. Nicole Christine spoke with a local woman about her experience receiving essential treatments during an unprecedented pandemic.
A year ago, Carly Zamani was on her way to the hospital with intestinal pain.
I went to the emergency room with some pain I thought was gallbladder, and I was in the emergency room and they found spots in several places on my pancreas, my liver, some of my female organs.
Biopsies brought the devastating news: stage 4 pancreatic cancer. Zamani faced treatments and hospital stays, one of which fell near the beginning of the COVID-19 outbreak.
It was kind of frightening, you watched everything on the news, and the day that they let me go home, actually they were locking the doors of the hospital, no one, no visitors in or out.
As someone with essential medical needs, Zamani says she's still been visiting medical centers for treatments. And while she's not alone statistically speaking, the pandemic has limited the amount of interaction she has during the treatments.
Definitely, it's a different situation in the doctor's office, social distancing, no extra visitors, things like that.
The isolation and day-to-day risks involved with the pandemic can hit hard for those already fighting serious health battles.
Just to have to think about, like all of us, I worry when I go to the grocery store or to the gas station. So I think for that group of patients and survivors, they're just extra susceptible to all of that in general.
Melissa Kettner says at the beginning of the pandemic, when elective surgeries and screenings weren't allowed, she was concerned.
We get lots of folks who are diagnosed through various kinds of screenings. And those aren't available. So right away, I was thinking this is going to cause some delay in new patient diagnosis and getting started with treatment.
The cancer support group Kettner leads has been able to meet virtually, but it's come with some barriers.
Because everyone just kind of wants to check in on one another and just talk about stress of what we're living in right now. And so it's been harder to delve into any deep content.
Zamani says she's found her source of support within her family and friend group.
My mother-in-law has definitely stepped up and taken, on the role of caregiver for me and for the kids.
She adds that her 3 children are also her source of strength.
It's made me want to stay strong for them and be well for them. So I've just done everything I can do to stay healthy and try to make life as normal for them as possible.
In Terre Haute, with local news that matters, Nicole Christine, WTWO.
She's an inspiration, no doubt. Kettner says the hardest part of the pandemic for her support group has been the loss of one of its members, a man named Mike. And he lost his life, and they weren't able to mourn together. Kettner called Mike one of the best men she's ever met.